Hello everyone. Myself Sakshar Saha. I'm an assistant professor from the Department of Pharmaceutical Technology, JISU University, welcoming all of you in today's lecture video. The topic I'm going to talk about, that is Pharmacology-II lab. The topic is of B.Pharm 5th semester, and the subject is having the subject code BPT 593. And on the topic I'm going to discuss today is study of effect of physostigmine on DRC of acetylcholine using frog rectus abdominis. So this is the topic I'm going to discuss. I have made a whiteboard presentation on that. Once the possibility will come to perform that in the laboratory, we will do that. So we will today discuss the theoretical part and the process or the procedure that we are gonna utilize to do this experiment. And we will also understand the significance of doing this experiment. So let's see what we have. So the topic, as we know, of today's discussion is going to be study of effect of physostigmine on DRC of acetylcholine using the biological system, that is frog rectus abdominis. I have not mentioned that, so put it in your notebook. The biological system is frog rectus abdominis. So that we will be using. So as we are specifically mentioning it is frog rectus abdominis, so I'm sure you guys are understanding that this is gonna be an in vitro method. And if it was not an in vitro method, we would have taken the whole animal and we would have said that it will be on a frog or rat or any other whole animal. So it is frog rectus abdominis. That means we are isolating a particular organ or particular kind of tissue. So that is why it is an in vitro method. So what we are going to study, the effect of physostigmine. So this is important on DRC. DRC is dose response curve of acetyl. ACH means acetylcholine. So before we move on to the full process, we should firstly know what is the function of physostigmine and what is actually physostigmine and what is acetylcholine. So I have mentioned over here physostigmine or physostigmine, whatever you can say, anything you can say, it is anti-CHE. Anti-CHE means anticholine esterase. Anticholine esterase, which basically anticholinesterase means which acts against cholinesterase. So it blocks or it acts, that's why I have put the mark cross, cholinesterase. So what is the function of cholinesterase? The cholinesterase is an enzyme which helps to metabolize or breaks down the acetylcholine. So if cholinesterase breaks down the acetylcholine and reduce the concentration or level of acetylcholine, so anticholinesterase will block that enzyme itself. If this enzyme which blocks or stops the function or level of acetylcholine, so giving the anti of that will help to increase the level of acetylcholine. So basically anticholinesterase increase the level of acetylcholine or increase or potentiate the effect of acetylcholine, right? And we need to know what is the function of acetylcholine. So acetylcholine, what is that? It is a parasympathetic neurotransmitter which acts on parasympathetic receptors. Those are muscarinic and nicotinic receptor. So we have three basic receptors in the muscarinic part, M1, M2, M3, and in case of nicotinic it is NM and NN. So here the biological system we are using frog rectus abdominis. So abdominis muscle is having a specific category of muscle, that is a smooth muscle. So if we have to consider this smooth muscle, so we have to think that which receptor of which receptor of parasympathetic system utilize the smooth muscles, or smooth muscle contains which kind of parasympathetic receptor. So that is M3 receptor. M3 receptor. So M3 receptor is present in the smooth muscle. So our today's concern is M3 receptor. So what is the basic function? M3 receptor causes the on the potentiation of M3 receptor, on the binding of agonist M3 receptor, increases the constriction of the muscle or contraction of the muscle, and on antagonizing this receptor, it will relax. So its basic function is constriction. Okay, so the basic funda is clear. Now what we're gonna do, we will see the effect of dose response curve. Like if we are increasing the dose, so our objective is, if we are giving the increasing dose of acetylcholine, so what is the dose response curve? Like with the increasing dose, whether the response is increasing or decreasing. And if we incorporate physostigmine along with acetylcholine, then what will be the response? Will it be like same or will it differ? If it differs, then how it is gonna differing? So all this thing we are gonna see today. So here in the principle of this particular experiment, we have to consider, there is a word, there is a terminology you have already heard, that is EC50. Okay, this is EC50. What is EC50? E for effective, C for concentration, 50. So effective concentration 50% or EC50 means it is an effective dose, effective concentration of a drug which is effective in the 50% of the population. Just like effective dose 50%, ED50, EC50 is same. ED50 is a dose, it is calculated in the mg, EC50 calculated in mg per ml, as it is concentration. So this is the basic difference. So if we have to consider the potency of a drug, so potency is equal to negative logarithm of EC50 base 10. So this is the formula of calculating the potency from EC50. Okay, so it has been seen that if the EC50 increases, which also increases the potency. This is the basic funda. So now what we're gonna do, we will take a frog. We will frog is having 4 limbs, so we will pin the 4 limb to a experimental board. So frog will be like stretched, and we have to cut the upper membrane of abdomen of the frog, and we have to take out the frog rectus abdominis, the part of abdomen which is near to rectum. We have to take it out. And what we're gonna do, so we are isolating the frog rectus abdominis. Next, we are stretching it for 3 times. We are stretching it for 3 times, like we are stretching the frog rectus, that tissue part, because we are trying to relax it. Thus, as it has a constriction property, the basic property, so it will shrink. So that is the reason we are stretching it. Okay. Next, we will be, as it is an in vitro method, we will be definitely utilizing the apparatus that is called what? That is called your student organ bath. So we are hanging that frog rectus abdominis with a tension of 1 gram. Like if we have to hang if we think the setup of that in vitro apparatus, that is student organ bath, so we have to hang the tissue in the organ tube. So to make a balance, we have to put a weight on the other side of the writing lever, or the portion where the tissue is hanging, right? So 1 gram with a 1 gram tension, we are putting it in a hanging position. Then we are giving time of 45 minutes for this tissue to relax, to get stabilized. Okay. After that, what we are doing, we are washing. Okay, and in case of every in vitro experimentation, we have to use a specific PBS, physiological buffer solution. So here the buffer solution will be ringer solution or frog's ringer solution, right? So we have to wash it for 4 to 5 times to this particular tissue, and then we have to add, and we have to, after washing, we have to select 4-5 doses of acetylcholine to incorporate and to see the response. So now we'll be recording the contraction. This is the contraction for increasing dose of acetylcholine. So as I said that we have to fix 4-5 doses. not 4 5 exactly, that would be a wrong statement. We have to give some doses, but the one thing you have to keep in mind whenever you're selecting the doses, the gap or the difference between two doses will always be same. If you selecting 0.1 0.3, then you have to take the next dose 0.5, so each dose having the difference of 0.2, right? So this is the way you have selected the dose, and you are taking the reading in the student organ but chymographic drum in the smoke paper. So now you are taking, and you have to give the dose of acetylcholine. You have to put that, you have to incorporate that in the frog's ringer lactate solution where the tissue is dipped, until you are seeing there is a saturated position, like the graph is like this. At some point you will see the graph is same, the height are same, so that is the final point. So now you have to stop. So you have to record the construction of increasing dose of acetylcholine. So what you have done, you have suppose 0.1, 0.3, 0.5, 0.7. You are seeing at 0.7 it is been saturated, the maximum response it is showing. So you are stopping the reaction, and you have you have jot down, you have noted down all the responses. What is responses? The height of the graph. That is the response. That will be like 1 centimeter, 5 centimeter, whatever it is gonna be. Along with the concentration, like for 0.1 it is 3 centimeter, for 0.3 it is 5 centimeter, like that. You have noted it down. Next, what you gonna do? So your acetylcholine part is done. Now so here we have not added any physostigmine. Keep in mind, again I'm making you remember that physostigmine increases the potency or effect of acetylcholine. Now what we are doing, the same frog rectus abdominis, we have to wash it with water and ringer lactate solution, frog's ringer solution. We have washed, then what we will do in the organ tube where your frog's rectus abdominis is present, in the dip which is dipped in the frog's ringer solution, where we will be incorporating, or we will be giving 2 microgram of physostigmine. We'll be putting 2 microgram per ml of physostigmine. Okay, we have given in the ringer solution. Next, we will wait for 30 minutes. After giving physostigmine, we'll wait for 30 minutes, because thus that physostigmine can get inside the tissue. So we'll be giving the resting time 30 minutes. And after that, we will record like 6. What is 6? Like if we just step it, it is step 1, it is step 2, it is step 3, it is step 4, it is step 5, so it is step 6. So we will be recording like step 6, like this. So we will again put the acetylcholine solution like the same concentration we did earlier, and we will see the graph, like how it is increasing, how much it is increasing, or what is the saturation point. The same thing we are going to study. The first one was in the absence of physostigmine, the second one was in the presence of physostigmine. So according to the theory, the experiment which we have done in the presence of physostigmine, the potency or the response in the presence of physostigmine of acetylcholine should increase. Alright, now that we are gonna study, calculate the dose ratio. Okay, and one more thing we have to one more information we have to keep in mind whenever we are doing the experimentation. Suppose presently the time is 6 p.m. So you are putting 6.00 p.m. Okay, it is the time when we are giving the first concentration of acetylcholine in a both case. So we are giving, and we are allowing it to create the graph in the chymographic drum. We will wait for 90 seconds. After 90 seconds, that means the 90 seconds is 1.30 minutes. 1 minute 30 seconds, right? So that means whenever the time will be 6.1 p.m. or 6.1.30 p.m. that time, like 6 hour 1 minute 30 seconds, that time we will be giving our next dose, that is 0.3 or 0.5, what is gonna be. So between two doses we have to wait 90 seconds. So we have to give 90 seconds of time for each dose to show its action. So this information you have to implement in case of both experimentation. And after that you have to make a table where in the left hand side there will be your your doses of acetylcholine. According to that, the log doses we have to calculate, and we have to put the responses, which is in the presence of physostigmine and in the absence of physostigmine. And from there we can calculate the EC50 value from the graphical representation. From the graphical representation we can calculate the EC50 value. So the dose ratio is gonna be EC50 with physostigmine, EC50 without physostigmine. So in case of physostigmine, which is the EC50, we are gonna see that there the graph we are going to see. In case of with physostigmine part, it is gonna be like this. But whenever it is without physostigmine, we can see the same kind of effect, but the distance between two graphs will be larger than this one. This is going to be the basic difference, and the response will definitely vary. So the graph that we are going to see, okay, so we have to calculate the EC50 value. We have to make a log graph. So the graph is going to be like this. It is log concentration, and it is your percentage response. Percentage R means percentage response. So the kind of graph it is gonna be like, so if it is like this, so most kind of this kind of graph. So this is with P, this is without P. Without P means physostigmine, this is with physostigmine. So what you gonna see in whenever the graph you are plotting in case of with physostigmine, it will slightly shift towards the left side from without physostigmine. Why? Because this gives the sense that with physostigmine, the effect of acetylcholine, the potentiation of acetylcholine increases, or potency of acetylcholine increases. That is why, at the lower dose, this is the log concentration. At the lower concentration, it started to show its effect. But in case of without physostigmine, it takes much more concentration to show its effect. And you have already studied, I have already shown in different video lecture that where how we are going to calculate which value from this particular kind of graphical representation we are going to take. The value we are going to take where we will be see a peak in like an increase, like which shows a steeper curve. That value where the responses are increasing in a steeper way, that we are going to take. So this is the way we are going to study the we are going to do this experiment, that is study of effect of physostigmine on the DRC, dose response curve of acetylcholine. So I hope you have understood this whole experiment. If there is any kind of confusion, we can definitely discuss this in the classes, in the upcoming classes. But before that, I'll request all of you to go through this video. I'm sure you will understand. The rest part we are going to discuss in the next class. Thank you so much. Thanks for watching.